Yeah, so that's a great question. So we published a study earlier this year that suggests that patients with therapy-related myelodysplastic syndrome may be disproportionately excluded from clinical trials. And this is primarily because these patients, a great proportion of these patients have a prior cancer, and traditional eligibility criteria for clinical trials exclude patients with prior cancers. So this means that in general, clinical trials that have been studying interventions in the MDS patient population may have been systematically excluding these patients with TMDS because of their prior history. So as we think about the implications of this, we can consider the fact that clinical trials that have been run over the last several decades may not have been including an appropriate proportion of patients with TMDS because of these eligibility criteria. Therefore, the outcomes may not be applicable within that specific patient population. So it's extraordinarily important as we move forward and we design clinical trials that the eligibility criteria are designed in a way that appropriately include patients with TMDS. So our outcomes suggest that eligibility criteria relevant to liver function, renal function, and comorbidities may be relaxed. So specifically, our outcomes suggest that patients who have minor renal function abnormalities have similar clinical outcomes to those without such abnormalities. So we can relax those criteria, specifically removing exclusion criteria relevant to minor creatinine and creatinine clearance abnormalities. For liver dysfunction, our outcomes suggest that we might be able to remove exclusion criteria relevant to AST, ALT, and minor bilirubin abnormalities, all of which measure your liver function. And then finally, for comorbidities, our outcomes indicate that patients who have comorbidities have similar outcomes to those without such comorbidities. So removing eligibility criteria relevant to comorbid conditions may also be appropriate. Now, the one caveat that I do want to mention is that patients who presented with chronic liver conditions did have worse clinical outcomes than those patients without such conditions, so it may still be appropriate to exclude those patients from clinical trials.